One, this video series contain high yield points wherein we will be discussing the most important points which you can revise during your last minute revision for your exams. So these short clips will contain the very important facts from different subjects. This video for anatomy will deal about the nerve supply for muscle groups. So there are certain muscle groups wherein they are supplied by a particular nerve except one particular muscle from that group which will be supplied by another nerve. So those muscles include pharynx, palate, tongue, muscles of facial expression, mastication and larynx. All the muscles of pharynx are supplied by pharyngeal plexus except stylopharyngeus which is supplied by glossopharyngeal nerve. All the muscles of palate are supplied by pharyngeal plexus except tensor veli palatini which is supplied by nerve to medial pterygoid, which is a branch of mandibular nerve which is a branch of again trigeminal nerve. All the muscles of tongue are supplied by hypoglossal nerve except palatoglossus which is supplied by pharyngeal plexus. All the muscles of facial expression are supplied by facial nerve except levator palpebrae superioris which is supplied by oculomotor nerve. All the muscles of mastication they are supplied by mandibular division of trigeminal nerve except buccinator. Though buccinator does not come under the primary muscles of mastication, it is an accessory muscle of mastication. So this buccinator comes under both accessory muscle of mastication as well as muscles of facial expression, and it is supplied by facial nerve. And lastly, all the muscles of larynx are supplied by recurrent laryngeal nerve except cricothyroid which is supplied by external branch of superior laryngeal nerve. So first one, nerve supply to pharynx. So as I have already mentioned, the pharynx is supplied by the pharyngeal plexus. So the pharyngeal plexus contains of nerve supply from 9, 10 and some of the sympathetic nerve. So we can see pharyngeal plexus is formed by pharyngeal branch of the vagus nerve which is a 10th cranial nerve. So the motor root will be derived from the 10th cranial nerve, whereas the pharyngeal branches of the glossopharyngeal nerve, that is 9th cranial nerve, and some pharyngeal branches from the sympathetic ganglion, some vasomotor supply. So pharyngeal plexus contain both nerve from 9, 10 as well as the systemic ganglion. So this is pharyngeal plexus. So all the muscles of pharynx are supplied by this particular pharyngeal plexus except the stylopharyngeus. So you can remember by the mnemonic, stylopharyngeus is a stylish muscle which tries to apply gloss all the time. So gloss. Stylopharyngeus is supplied by glossopharyngeal nerve, and glossopharyngeal nerve is a 9th cranial nerve. Next one, larynx. So under larynx we have intrinsic group of muscle and extrinsic group of muscle. So whenever we read this point, all the muscles of larynx are supplied by so and so except this, we are meaning the intrinsic muscle of larynx. So what are those intrinsic muscle? So the intrinsic muscles of larynx include cricothyroid, posterior cricoarytenoid, lateral cricoarytenoid, transverse arytenoid, oblique arytenoid and aryepiglotticus, thyroarytenoid and thyroepiglotticus, and then lastly vocalis. So these intrinsic group of muscle, totally 9 muscles will be there. These muscles, all the muscles are supplied by recurrent laryngeal nerve except the cricothyroid which is supplied by external branch of superior laryngeal nerve. So extrinsic muscle of larynx, they are the accessory muscle for larynx which are used for elevating and depression of the larynx. So though they are not useful for the main function of the larynx as such, but the position of the larynx, the elevation and depression is dependent upon the super outside muscle, that is extrinsic muscle of larynx. So these extrinsic muscle of larynx are, the elevators include the suprahyoid muscle and the longitudinal muscle of the pharynx. Suprahyoid muscles include mylohyoid, stylohyoid, geniohyoid and digastric muscle. The longitudinal muscle of the pharynx include stylopharyngeus, salpingopharyngeus and palatopharyngeus. The depressor of the larynx include the infrahyoid muscle, which are the sternohyoid, sternothyroid and omohyoid. So the suprahyoid muscle. Suprahyoid we have digastric, geniohyoid, stylohyoid and mylohyoid. Digastric, it has anterior belly and posterior belly. Anterior belly, it originates from the digastric fossa of the mandible and it gets inserted in the intermediate tendon of the digastric attached to the hyoid bone, whereas the posterior belly, it originates from the mastoid notch and it gets attached in the intermediate tendon of the digastric attached to the hyoid bone. So the nerve supply for the anterior belly is mylohyoid nerve, which is the branch of mandibular nerve, which is a branch of trigeminal nerve, which means anterior belly is supplied by 5th cranial nerve, whereas posterior belly is supplied by facial nerve. Then we have geniohyoid, stylohyoid, mylohyoid. Geniohyoid origin is interior mental spine of the symphysis, that is in the mandible we have 4 tubercles. They are called as genial tubercle on the inner portion of the mandible. The upper portion gives rise to attachment of genioglossus. Remember, gloss means tongue. So upper musculature will be something related to tongue. The lower musculature related to the below one hyoid. So there will be 4 dots on the inside of the mandible. The upper 2 dots are called as superior genial tubercle, whereas the lower 2 dots are called as inferior genial tubercle, or also known as interior mental spine. The upper one are called as superior genial tubercle or superior mental spine. So the upper one gives origin to the genioglossus muscle. So from the superior mental spine it gets attached to the tongue. The lower one from the mental spine it goes down, gets attached to the hyoid. So geniohyoid, the origin is the inferior genial tubercle of the symphysis of mandible, and it gets inserted in the hyoid bone. The nerve supply is C1, ansa cervicalis, via the hypoglossal nerve. Then stylohyoid muscle. Stylohyoid muscle, it gets attached, as the name says, stylohyoid, from the styloid process to the hyoid bone, and it is supplied by facial nerve. Then lastly, mylohyoid. So mylohyoid, so it is attached from mylohyoid line to the hyoid bone, and it is supplied by mylohyoid nerve, which is a branch of mandibular nerve. Then we have infrahyoid muscle. So infrahyoid we have sternohyoid, sternothyroid, thyrohyoid and omohyoid. Sternohyoid, so as the name states, sternohyoid. So it is sternum to the hyoid bone. So originates from the posterior surface of the manubrium sterni, that is the sternum bone, to inserted into the hyoid bone. Nerve supply is through ansa cervicalis. Then we have sternothyroid. Sternothyroid, so it is from sternum to the thyroid cartilage. So it is originated from the manubrium sterni and inserted into the oblique line of thyroid cartilage. Again it is supplied by ansa cervicalis. Then we have thyrohyoid, which is thyrohyoid. So thyroid cartilage to the hyoid bone. So it is originated from thyroid cartilage, inserted into the greater corner of hyoid bone, and it is supplied by C1 via hypoglossal nerve. Then we have omohyoid. So omohyoid, there is superior belly and inferior belly. Superior belly, the insertion is into the hyoid bone, origin is the intermediate tendon, whereas the inferior belly, origin is superior border of the scapula, and the insertion is in the intermediate tendon. And omohyoid, superior belly is supplied by superior root of ansa cervicalis, inferior belly is supplied by the proper ansa cervicalis. Or in short, how you can remember is, all the infrahyoid muscles, they are supplied by ansa cervicalis except the C1. Ansa cervicalis will have supply from the sympathetic trunk C1, C2, C3, like cervical sympathetic ganglion. But thyrohyoid alone, it is directly through a hypoglossal nerve. Like how in the geniohyoid it is the C1 through the hypoglossal nerve, same way in infrahyoid it is thyrohyoid, C1 through hypoglossal nerve. So geniohyoid and thyrohyoid is C1 through the hypoglossal nerve. Then we have the tongue. So under the tongue we have motor supply, sensory supply and taste sensation. So motor supply, we know all the muscles are innervated by the 12th cranial nerve, which is hypoglossal nerve, except the palatoglossus, which is supplied by the pharyngeal plexus through vagus nerve. So this is for the motor supply, that is the muscles of the tongue. Both intrinsic and extrinsic together, all of them are supplied by hypoglossal, except the palatoglossus muscle. Whereas now coming to the sensory innervation. So under the sensory innervation we have touch sensation and taste sensation. So taste sensation is a special innervation, whereas the touch sensation is a normal general sensation. So under the sensory innervation you can divide them into anterior 2/3, posterior 1/3 and the posterior most part of it. So the anterior 2/3, the touch sensation is supplied by the lingual nerve, whereas taste sensation is by cauda tympani nerve through the facial nerve. So the sensory for anterior 2/3 is mandibular nerve, which is a 5th cranial nerve, whereas the taste sensation is facial nerve, which is a 7th cranial nerve. Then we have posterior 1/3. So for posterior 1/3, both the touch and taste, that is the general sensation and the special sensation, both of them are supplied by the 9th cranial nerve, which is the glossopharyngeal nerve. Whereas we have posterior most part. I don't want to complicate here. No need to remember the anterior to epiglottis and posterior to epiglottis. Just remember the posterior most part, that is a pharyngeal most part of the tongue, is supplied by, you can remember, just the vagus nerve. So just remember, anterior 1/3, the general sensation is lingual nerve. Taste sensation is quadrant tympani nerve through facial nerve. Posterior part, both the sensation is through the 9th cranial nerve, and the posterior most part is by 10th cranial nerve through pharyngeal plexus. Then we have muscles of facial expression. Muscles of facial expression is supplied by the facial nerve, which has all these branches: temporal branches, zygomatic branch, buccal branch, marginal mandibular branch, and cervical branches, and these are the muscles supplied by it. Then we have muscles of mastication. So muscles of mastication, we have 4 muscles: masseter, temporalis, medial pterygoid, and lateral pterygoid. So muscles of mastication, masseter is supplied by masseteric nerve from the anterior trunk of the mandibular nerve. Temporalis is supplied by deep temporal nerve from the anterior trunk of mandibular nerve. Medial pterygoid is supplied by directly from the mandibular nerve. So just you can see masseter, temporalis, lateral pterygoid. All these 3 muscles, although they are supplied by mandibular nerve, there is a anterior trunk from it, and from the anterior trunk you have masseteric nerve, deep temporal nerve, and nerve to lateral pterygoid. But whereas if you see medial pterygoid, from the mandibular nerve directly there are branches, 3 branches. One is anterior trunk, then another one is nerve to medial pterygoid, then another branch is posterior trunk. So from the posterior trunk only you have auriculotemporal nerve, then mandibular nerve, and then mandibular nerve enters the inferior alveolar canal, and from there it exits into mental nerve and mylohyoid nerve. So this is the route. So remember, from the mandibular nerve, all the 3 muscles are from the anterior trunk, whereas directly from the mandibular nerve there is a route called nerve to medial pterygoid. This is the supply for muscles of mastication. Next one is muscles of soft palate. So muscles of soft palate, there is a little bit of controversy here. So just remember, we have already seen for the muscles of soft palate, all the muscles are supplied by pharyngeal plexus. Pharyngeal plexus contains innervation from 9th cranial nerve, 10th cranial nerve, and the sympathetic cervical plexus, except the tensor veli palatini, which is supplied by the nerve to medial pterygoid. So from the nerve to medial pterygoid, when the branch goes, there is one small branch which supplies 2 more muscles. They include tensor veli palatini and tensor tympani. So this is what we have been studying from the beginning. This is what the muscle supply was. But what happened? There was a little bit controversy related to muscles of soft palate. This was when there were many research studies published. They said that we have 5 muscles of soft palate. We have musculus uvulae, tensor veli palatini, levator veli palatini, palatoglossus, and palatopharyngeus. So of which we know it is very clear that tensor veli palatini is supplied by the nerve to medial pterygoid, that is the mandibular nerve. So that is clear. And we said all the other muscles are supplied by pharyngeal plexus. Now in some of the studies they have mentioned that musculus uvulae is actually not supplied by the pharyngeal plexus, rather it is supplied by lesser petrosal nerve, which is a branch of lesser palatine nerve, which is a branch of maxillary nerve. So which means this also comes under the 5th cranial nerve, because cranial nerve, maxillary nerve, and mandibular nerve is a branch of trigeminal nerve. So here comes a little bit confusion. So I don't want to confuse you when you are doing your last minute revision, but just keep in mind the classical line is all the muscles of palate are supplied by pharyngeal plexus except the tensor veli palatini. But in case if there is a twist related to musculus uvulae and you don't find the classical option, that is pharyngeal plexus, then you search for the word lesser palatine nerve, or to put it on the other word, in case if you find the word lesser palatine nerve specifically with musculus uvulae, then think twice before answering the question. It is wise if you attend the question, do not leave the question, because it is a controversial question. If you attend the question, you will definitely get some correct answer, but just keep in mind, it is always very clear if other muscles are given, it is pharyngeal plexus. Only for musculus uvulae, think before you answer the question. So to sum up, we saw about muscles of pharynx, muscles of palate, muscles of tongue, muscles of facial expression, mastication, and larynx. So buccinator, it comes under both muscles of facial expression as well as an accessory muscle of mastication. Just remember, muscles of mastication, we have only 4 muscles. They are the primary muscles. Buccinator is an accessory muscle of mastication. Thank you all.